So if you suffer from dry eye syndrome, then there's a good chance that a component of your dryness comes from evaporative forms of dry eye disease. And in this video, I'm going to break down the different dry eye treatments that are available for evaporative dry eye. That's today's video. Let's take a look. This video is made possible by EyeEco, makers of high-quality, natural, and drug-free dry eye relief products. Thank you to EyeEco for keeping our eyes feeling hydrated. Hello and welcome, this is Dr. Alan here from the Dr. Eye Health Show, helping you learn all about the eye's vision and finding the best vision products. If you're new here to the channel and you like learning about the eyes, then consider hitting the subscribe button down below so you don't miss any of our future videos. Now again, today we're going to be talking about evaporative forms of dry eye treatment, and whether that be something that you can just do at home on your own, it's a very conservative treatment, or if it's something more advanced that you can only be done in an eye clinic, we're going to be covering all of that. Now, when it comes to evaporative forms of dry eye, probably the most popular and most common contributing factor for evaporation has to do with what's called meibomian gland dysfunction, or MGD. This is where the oil glands in the eyelids, called the meibomian glands, they stop producing enough oils to stop the tears from evaporating, or the oils themselves could be just very poor quality. Now, most commonly, eye care professionals will often recommend a conservative treatment of just doing warm compresses at home. A warm compress is a way to get heat to the eyelids so that the oils trapped in those lids can be melted and allow those oils to leach out so your eyelids can make new, fresh oils that'll help prevent your tears from evaporating. Now, there are many different ways to do warm compresses, and I've recommended several of them throughout time here on this channel. Some of my favorite ones are ones that you actually heat up at home, or they activate and then they provide not just heat, but moist heat. It is important to note that if you're doing warm compresses on your own, you do need to do them for at least 10 to 20 minutes at a time, and they have to be a consistent amount of heat to have any sort of clinical benefit. Then after doing warm compresses, oftentimes doctors will recommend doing a digital massage or some form of massage to encourage those oils that have now been melted by the heat of the warm compress to kind of push and squeegee out any of those thickened oils out of the eyelids. You can do that just digitally with your finger, and I have a whole video guide on how to do that. Again, I'll put that in the video description below, but there's also other devices that can be used to help with this too. One of those tools that I've used is one called the Eyelids device. This is almost kind of like an electric toothbrush, but it helps clean the eyelids and then has an oscillating kind of sonic motion that helps agitate the eyelids and allows those oils to break up and again release out of those lids. And then there's even a newer warm compress to the market from EyeEco that heats up the eyelids like a warm compress, but then also has a vibrating function in it to help again agitate those eyelids and get those oils to release. Now, because meibomian gland dysfunction is so common and is really the leading cause for evaporative forms of dry eye disease in many cases, there's a lot of research going into different ways we can treat it. Right now, most studies do implicate that basically everybody with mild to severe forms of meibomian gland dysfunction could benefit from having some form of heatable and mechanical compression done in the clinic. This can be done through a device called LipiFlow, which some clinics will have, and then some clinics will even have another one called Eyelid, which basically do the same thing. They heat up the eyelids in the office, but allow for a compression motion that compresses both sides of the eyelid to really fully get all of those thickened oils out of those lids. Outside of these two current treatments, the Eyelid and the LipiFlow, there is also the treatment of using what's called IPL, or intense pulsed light. It's used off-label, but it does also help with the oil glands of the eyelids and helps people produce better oils of the eye. Now, in fact, there are many other treatments for MGD, and I want to go into more detail about them, but we're going to save that for another video. So if you are not, in fact, subscribed to the channel, make sure you do that so that you get a notification when that video comes out. Now, outside of just the meibomian gland dysfunction, people can also have lid aperture disorders. This is where the eyelids don't close 100% correctly, and that leaves air around the surrounding eye to cause evaporation of the tears. Now, one of the more medical causes for this could be something like thyroid eye disease. This is where Problems with their thyroid cause their eye muscles to swell, and that'll push the eyes outward. And that means their eyelids aren't going to close over the eye 100%. Or it could be something like Bell's palsy, where the side of a patient's face may droop, and then the eyelids, again, don't close correctly onto the eye. For any medical cause for something like this that's affecting the eye, then of course medical treatment is going to be necessary to help that person. Otherwise, some people just have a hard time closing their eyelids all the way, or they even sleep with their eyelids open. For these individuals, a conservative treatment of using lubricating eye drops throughout the day, or using something thicker like a gel or an ointment lubricating treatment at nighttime before bed can be helpful. That's going to help coat the surface of the eye and prevent air from causing further dryness to the surface. Some people may even benefit from a nighttime sleep mask while they're sleeping to again help prevent the tears from just evaporating into the air. Now, even if you're somebody whose eyelid closes normally, just because of the general humidity in the air around you where you're living, or it could be something like temperature, or it could be just airflow too, could also cause the tears from the surface of the eye to evaporate faster. If you do live in a place where the humidity of the air is very low, I know here in the wintertime for me, we have the furnaces on all the time, and that's going to cause the tears on the surface of the eye to evaporate really quickly. In fact, I used to work at a lot of senior homes or in hospitals where the heater or the furnace is on all the time, and everybody complained of dry eye. For this reason, if you're someone with that low humidity, you could consider getting a humidifier for your office or bedroom or your place of work. There's many different humidifiers out on the market. I just do encourage, if you get one, make sure you're filling it full of distilled water and not just tap water, because tap water has other minerals and deposits in there that could be vaporized, and that ends up getting into the air onto your eye. You could be breathing that in, or it could even clog up your furnace. And I only say that because it happened to me once and I had to call like a repairman out and everything. So yes, learn from my mistakes. The other big environmental cause is that of airflow. If you're somebody who has air conditioning or a furnace blowing directly into your eye, or a fan or something like that, then that again is going to cause the tears to evaporate quicker. There are treatment options such as using moisture chamber goggles, which are special eyewear that helps prevent the tears from evaporating quickly, just kind of holds the moisture level around the eyes at the proper amount. And then if you happen to be somebody who has a CPAP machine, sometimes those CPAPs will break a seal and the air will get blown right into the eye. And so you wake up with really dry, irritated eyes. For somebody that's having that issue, you could go again the route of using gels or ointments, but there's also nighttime sleep masks specifically designed just for CPAP machines. So again, I'll put some different resources all in the description below if you want to find those. Now, if you happen to be a contact lens wearer, unfortunately, contact lenses are just well known to cause more dryness symptoms on the surface of the eye. Now, contact lenses, they cause more dryness because the lipid layer on the surface of the eye is kind of disrupted by the contact lens, and so it starts to spread out very thin. And then the contact lens soaks up more moisture, and it just increases the evaporation rate from the surface of the eye. If you're someone who just can't switch to glasses and just loves wearing contact lenses like myself, I would recommend looking for a contact lens that is better for dry eye. First of all, speak with your local eye care professional what's best for you, but at least my personal preference, I think the Daily Total One by Alcon or the new Bausch & Lomb Infuse lens, those are probably my two top favorite for people with dry eye symptoms. Now, there's two other things that we should discuss about evaporative forms of dry eye and their treatments, but before I go over that, let me know in the comments section if you're struggling with evaporative forms of dry eye right now. Have you tried anything? What really offered you the most success? Drop that in the comment section below, because it's something I want to know about, but also because other people will be able to connect with you and figure out what brought you success, and hopefully that'll help them too. Now, another major contributing factor that doctors need to be aware of and treat along with dry eye is that of ocular surface diseases, namely blepharitis and allergic conjunctivitis. Blepharitis is a buildup of dead skin cells and oils that get stuck on the surface of the eyelids, which can cause inflammation and irritation. And then allergic conjunctivitis is where any sort of antigen that could be in the environment gets on the eyelids, and again, that causes inflammation. This inflammation, irritation can disrupt the tear film on the surface of the eye and really exacerbate dry eye symptoms. And usually treatment for blepharitis and allergies can include things like cleaning the eyelids every day with some sort of an eyelid cleanser, warm compresses, those really help for blepharitis. And then for allergies, it could be something as just as simple as using a topical antihistamine eye drop or using oral antihistamines. The only downside of using oral antihistamines for allergies is that these usually also dry out the body and therefore can exacerbate dry eye symptoms. Now, I really hope you found this video helpful. I know it gets a little complex. Dry eye is just a difficult and complex disease, but if you yourself are looking to find more information about different types of dry eye, again, even more different types of treatments that are available, then you can check out our full series by clicking or tapping the screen over here to the side, or if you want to see a different video from the Dr. Eye Health channel, you can go ahead and click or tap the screen down over here. Again, this is Dr. Joseph Allen here from the Dr. Eye Health Show. Keep an eye on it, and we'll talk to you soon.